In medicine, there's one question that matters more than almost anything else. Who paid for the study? Because if you follow the money, you often find the story changes. And in the case of testosterone replacement therapy, TRT, the money trail is hard to ignore. Let's rewind to 2013. A Veterans Affairs study made headlines. Older men with heart disease who were taking TRT had a 29% higher rate of death, heart attack, or stroke compared to those who weren't. That got attention. Regulators added warnings. Doctors grew cautious. Then came the pushback. Several new studies emerged, some showing no increased cardiovascular risk, and a few even suggesting that TRT users had lower death rates than non-users. The difference? Many of those counter studies were funded, supported, or heavily influenced by pharmaceutical companies that manufacture TRT products. And here's where it gets tricky. Independent meta-analyses, those done by universities or public health agencies without industry money, tend to produce mixed or cautious results. Some benefit in carefully screened men, but uncertainty for those with existing heart disease. Industry-funded research? The overwhelming majority report neutral or favorable outcomes. This isn't a conspiracy theory. It's a documented, decades-long trend across medicine. Studies funded by the company selling a product are statistically far more likely to show that product in a favorable light. Why? Not necessarily because the data is falsified, that's rare and risky, but because the design, timing, and reporting can all be shaped to tip the scales, choosing patients who are young, healthy, and unlikely to have bad outcomes. Running the trial for too short a time to detect rare but serious side effects. Publishing positive findings quickly while delaying or burying negative results. Emphasizing secondary endpoints that make the drug look good, even if the main safety signals are concerning. With TRT, the 2023 New England Journal of Medicine trial, involving over 5,000 men, found no increase in heart attack, stroke, or cardiovascular death over 3 years. But there's an important detail. The men in that trial were carefully screened, closely monitored, and excluded if they had unstable heart disease. That's not how TRT is always prescribed in the real world, which raises the question, what happens when TRT is prescribed casually, without thorough screening, without ongoing monitoring of blood pressure, hematocrit, and prostate health? That's the world where risks can rise, and where we don't yet have clear answers. TRT might be life-changing for the right patient under the right care. But history, from Vioxx to Fen-Phen to hormone replacement therapy, tells us that when profits are at stake, the safest version of the story is often the one they want you to hear. This has been What You Weren't Told. Share this story with someone who values the truth. Like and subscribe. It motivates us to create more stories like this one. And I'll leave you with this. When you hear the studies show it's safe, the first question you should ask is, who paid for the study?